Representative Garamendi, you have a chart up there. You have a schematic.
I have this chart. We've used it before as we've discussed Medicare, and it brings this whole thing right into focus. This is a tombstone. Medicare, 1966, 2011, created by LBJ, destroyed by the GOP. You know, maybe a little harsh, but this is really the reality of what's going on here. It's the end of Medicare as we know it. It's the end of the guaranteed benefit program, and it does turn everyone who is 55 years and younger over to the insurance industry. I spoke to this briefly before, but I was, and Mr. Courtney, thank you for reminding me that I was the insurance commissioner in California for 8 years. And I fought tooth and nail with the insurance industry over health care and automobile and homeowner and other kinds of insurance. In the healthcare sector, the private health insurance companies are about profit. That's their goal. They are a profit-making organization. And to enhance their profits, they do a variety of things. Deny coverage. You got a policy? Oh, but that was a pre-existing condition, and therefore we're not going to cover it. Or, gee, that kind of treatment's not covered. There was a lot of talk about death panel. I'll tell you where the real death panel is, and I saw this as insurance commissioner. I saw insurance companies denying treatment that led to the death of numerous individuals over those years. The real death panels have been the private insurance companies. Medicare, I know of no case where that has happened. Maybe it did, but I'm not aware of it, and I had the biggest state, California. And also this kind of discrimination that takes place. Medicare on the end, let me just put this additional to it. The private health insurance company is grossly inefficient. It is inefficient. It has enormous additional costs that Medicare does not have. By comparison, Medicare is a very efficient operation. It takes about 2% to raise the money and another maybe 2 or 3% to pay the bills. And on the healthcare, on the provider side, maybe another 10% to do the billing also. Maybe the total cost is somewhere in about 15% administrative cost. The private insurance companies run somewhere near 30% administrative cost when you consider profit, when you consider the advertising, sales commissions, and they have thousands of different policies covering this but not covering that, this deductible, that deductible, and when it gets to the provider, the ultimate chaos. And so the administrative cost in the private system is about twice what it is in Medicare. Medicare is a very efficient, very effective, universal program that raises the money in a very fair way. All of us pay for it, and all of us should be getting that benefit when we get to be 65. But not so in the private sector. Our Republican colleagues want to take all of this money and hand it over to the private insurance market and say, okay, you guys take care of it. Less efficient, certainly deadly in denying coverage and benefits, and just, compared to Medicare, very inefficient. Mr. Tonko?
Well, Representative Garamendi,